All right, we're back and we're so excited today. We have Tina Parks with us with Happy Hormone Cottage, right? I said that right.
That is
And she
correct.
is a board certified nurse practitioner who works with women and hormones. And we are excited to talk about hormones and mental health.
Yes, I'm excited. Not only am I excited to talk about it, I'm excited to do this work every single day. So as you can see me, and I just logged off from another woman in need. So yeah, I work for the Happy Hormone Cottage, and it's called Happy Hormone Cottage because it really used to be a cottage. It was a little spot where women could get together and say, "Hey, are you having this? Is it just me? Am I crazy?" Women can come together and say, "I went to my doctor, I had no help. My mother didn't teach me anything. I feel like I'm crazy. Maybe
Mm,
I'm just making this up." Or women who were told that it was psychosomatic, their symptoms
mm,
meaning all in their head, right? Or they were given diagnosis of depression, anxiety, ADHD, even psychosis at some point, right? Told them they were totally nuts. And nobody went to the root cause of what is causing this issue. Then when we started getting more knowledge about hormones, early 2000s, late 90s, early 2000s, they would go to their doctor and say, "Hey, I'm burning up hot at night. I can't sleep. I'm sweating through my clothes. I have migraines. I can't focus." Or they're really emotional. They're saying, like, "I was never like this before. I was tough as nails. Now I'm crying over everything. Things hurt my feelings. I feel rejected very easily. I take things the wrong way. And then later on, I'm like, why did that bother me so much?" Right? So it was their hormones, or they went in the opposite direction and they were mean.
mm.
Period. They're mean. Their kids are like, "Oh God, everybody's grandma didn't go sweet. Some
Uh,
people's grandma got mean and like, keep these kids out of my house. And it was their hormones that caused severe personality changes. So when they went to the doctor and their hair was falling out and they have no sex drive and they have vaginal dryness, they were told, "You're getting old."
yeah.
Right? And that was it. "You're old. You should, yeah, you ache. Your back aches. Sure, you're old."
I love that we are having you on as a guest because, we didn't get as much time to talk offline besides our shared love for Chicago, but a big shift in my career from being a personal trainer and a nutrition specialist to becoming a health and life coach and then stress and mindset coach was I was seeing my clients technically following nutrition plans, being able to do what they were committed to, but after 6 months, they would kind of regain it all back and go through the same cycle. And I really wanted to understand like the underlying psychology that was creating it. And what I discovered was just how impactful our hormones are in influencing our psychology. So all those examples you just gave about like feeling overly emotional and how society or different narratives tell us like, oh, that's a you problem, when really it could be indicative of something going on within our body. And I don't know if you guys have been present to it, Tina. I'm sure you have that like what's top of mind in a lot of political light. It's like a lot of medical research around female health hasn't been invested in because our cycle made us irregularity to scientific research. So a lot of the things that have been created for us were technically created based on a man's body, not a female's body. So I really love, I might be biased because I'm a lady, but I
That's
love that we are shedding more light into the impact our natural organic body has on us and how to listen to it. So I'm really
yes.
excited to hear what you have to say about how people might experience, hormone deficits, what to do, and how that does relate to mental and emotional health.
Sure. I just want to say also in hormone world, here's a couple of things that people should be aware of. First of all, your OB-GYNs, your OBs, your gynes, your primary, they may not be trained in hormones at all. So it's not that they're negligent. This is just not their bag. It's
Right.
not what they do. Sometimes they may send you to a specialist like an endocrinologist, but the endocrinologist may specialize in diabetes. You see what I'm saying? So they do hormones, but not necessarily women's health hormones. So sometimes your provider will try stuff like, "You're depressed, here's an antidepressant,"
Mm.
right? They now have medications like, "Oh, vasomotor, you're overhyped." right? Give you a pill for that. Now you might end up on 6 different pills for, oh, you can't sleep. Oh, you have constipation. You know what I'm saying? We just keep giving you more meds to treat the thing that you paying for. In hormone world, we're going to what is causing that, right? Which is two totally different things. We talk about root cause analysis. So that's a big thing. Also in healthcare, we have to remember that our healthcare system is built on a sick model. You are not sick, you are imbalanced. And those are two different things. So when you go to your doctor and they draw your labs and they scan you to pieces and they do all this stuff and they go, you're fine. You are, you're not sick, right? And so understanding that menopause, perimenopause, it is normal, it is natural, it is anticipated. From the day you were born, we knew this was going to happen. We should act like it, right? And we're just waiting for it to show up. As sure as you're born, it's happening. The ovaries are designed to shut off eventually, right? So they retire once they know you're not going to have any more children.
Yeah.
And we know that. But once upon a time, we weren't living 4 decades in menopause. And even if you were, you also weren't still running a full career business, right? Trying to keep your sex life going and all this kind of stuff postmenopausally. So some of that stuff that we're dealing with, it's because also our lives require us to still show up like you're 35. Even though you're 65 or 45.
Forever 40 is what I'm going.
Yeah, you're in your 40s, but you still have to show up. And then also our culture has changed where we are having an emerging generation. We will be sandwiched like none other because people are having children at 40, 42. So they will be in the throes of menopause with a 4-year-old, right?
That's horrible.
They will be in the throes of perimenopause and menopause with small kids. So that means when your mothers were in menopause, you guys were teenagers or out of your house, out of her hair, because she could go and relax, right? We will now, in the sandwich generation, be taking care of older and aging parents. And at the same time, still got homework to do and still got, soccer games to show up for. And, we will be perimenopausal with a daughter who's just hitting puberty all at the same time. So we also, in a perimenopause world, we need our mental health to be stable because we have to show up in ways that our foreparents did not, right? We have a whole other new entrepreneurs and all this kind of stuff. So we need to be stable. And also this has an impact on every one of our relationships, including the relationship with ourselves. So this is
more about that. How does our hormones affect I'm just gonna jump. How do our hormones affect our relationship with ourselves?
Sure, absolutely. If you are a woman and now you have absolutely no sex drive, none, doesn't even cross your mind, and you're 42 years old, and you still have a husband that you love and you want to be engaged, but it does nothing for you. You feel nothing. Now you have to fake it. It makes you feel bad about yourself, or it's painful and uncomfortable. You start getting low, then you start feeling bad for him. Like, poor Brian, he doesn't deserve this. You start saying crazy stuff, telling him like, you should get a younger woman, just leave me. It affects how you feel about yourself. You don't feel sexy anymore, right? Also, you can't, this is fall. You can't wear your cute sweaters and your layers and you're burning up hot. So you don't feel cute. Now you're dressing for the hot flashes. Right? So you don't feel well. Your hair is falling out. We know that your hair is your crown, and so much of how we feel about ourselves when you look in the mirror, and the hair is falling out and things like that, that affects you big time. So how you feel about yourself personally, also having some get up and go, waking up feeling like you're dragging through life every day, but you also didn't sleep. Because your sleep is escaping you with the loss of hormones. So now you're not sleeping and you feel tired all day and you're at work in a purple haze. It affects your relationship with yourself. So God forbid you don't feel like working out. You think about it. It's like, I know I should. You got the membership, you did the thing, but you have no motivation and no energy. And that's directly affected by your hormones. Now we add on the fact that now that you're not sleeping, your cortisol levels are bad. So good luck with losing weight. We all know that weight loss is directly impacted by how you're resting. Right? So it's all of those things. So now you just feel tired, you feel low, you don't look the way you want to look, you don't feel the way you want to feel. And then you start adding on the physical symptoms. So you're just kind of in this fight of being frustrated, almost feeling like you're trapped in your own body. Like, somebody let me out.
So I feel like that is so valid, so accurate, well said. And it kind of takes me back to that, like there's a lot of research done on like male health instead of female health. And so when I was listening, it's like we've learned to think that there's something wrong with our body when it doesn't perform based on the societal messages, right? And when we believe like, oh, we're supposed to have these sex cravings or we're supposed to feel more energized or be able to sleep or regulate our temperature and we're not able to, we look and blame ourselves.
Correct.
So I feel like it sounds like a dual like healing process of like getting to know your body and like what it feels like with your hormones and kind of ditching the societal messages of like this is what it means to live in your body and if it's not performing this way then there's something wrong with you. So my question is how can we welcome, the different chapters or flows of our hormone ups and downs?
Absolutely. One of the things we have to do is heal our relationship with the word old
Mm.
and aging. We have such a negative relationship with the word old. In our culture, old is bad, right?
Yeah.
So we say things like 50 is the new 40. No, it's not. It's not. Not, right? But why
Yeah.
is 50 a bad thing? Why do you need to be 40? 40 is not the new 30. It's not, right? So
Damn
Mhm.
it.
instead, right, we should feel good about the number that we are. So as soon as we see that number, oh, don't say my age, right? Oh, or you're constantly searching to look and feel a different age instead of saying I'm here. And once I'm in menopause, congratulations to me. I don't have to deal with that crap anymore. I'm on the finish line. I'm high fiving ladies that's crossing over. Feel bad for my friends that are still going through periods. Like, I'm done. I'm done. I repurposed my pad and tampon money for myself, and now I get massage. You see what I'm saying? And being joyful about being done, fully aware that I don't want any more children. I'm fine, or I never did want children in the first place, so I'm fine. However, I should be in this place and be fine, but I should feel good, right? It's just so happened that we want to be in a place where it is, I welcome these hormonal changes, what I knew was happening, but then I should get myself tested and get my hormones balanced so that I can enjoy this place instead of feeling the need to be like, oh, I don't want to feel old. I don't want to look old. We keep this thing quiet. We're kind of almost like a shameful thing that you're in this place instead of celebratory. Like there should be menopause parties. That
I
is
love
a
that.
blessing. You know what I'm saying? You
We
can go on
start that? Let's start that.
Let's start that. Go on vacation whenever you want. You can have sex whenever you want. You're not afraid of getting pregnant when you don't want to anymore. It's no PMS. It's over.
Nice.
And
That
it's
does
life's
sound like a reason
graduation.
to celebrate.
I know.
Absolutely. We should see it as life's graduation, that we're done with that space in our life. And done doesn't mean something negative or bad is happening to us. So we need to change our relationship with how we see aging. Or, even now, if you say, like, oh, this person was 72, and they'll be like, oh, she was so young. And you're like, 72 is not necessarily young, and that's okay. You know what I'm saying? That's okay.
Yeah.
So it's just the way that we've been taught and trained to think about aging, to think about what it means to be, quote, older. Even the word geriatric, right? Remember when we said geriatric pregnancies and people went insane?
Yeah.
Because we saw geriatrics like you're on a walker, and it just simply means, right, the study of the aging population. So you get your AARP card at 50, right? And you're considered geriatric. But because we have accepted that to mean something negative, right? We freak out. We are demanding that people change that word. Don't associate it.
One thing I'm looking forward to is the 55 and up communities.
You see see what I'm saying? You should start being like, great empty nester club, as we are starting to revamp, reimagine what it means to age. And this is going to be important because number one, we have so many baby boomers, right? There's a zillion of them who are retiring. And then our next biggest group, if the baby boomers had all those kids, right? The next biggest group is going to be the aging millennials. And the millennials are now 40. So the millennials are in their late 30s, early 40s. And this is another big group of people. And so now the millennials are coming behind the Gen Xers as well. I'm saying, you know what? I'm going to do this thing different. You know, I saw my mom have to suffer through it. And unfortunately, our foremothers had to suffer through it because there were no options. There was no education. And then to your point, a lot of the studies that was originally done on hormones were done on women who were never going to be candidates for hormones. We didn't take into consideration their other medical history, their age. Did they already have breast cancer at the time, right? We didn't take into consideration race. We didn't take into consideration anything. It just came out like hormones are bad, 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 bad. And it spread, right? And nobody said, well, wait a minute, let's get some more quantitative and qualitative information on these people. What doses were they taking? Were they synthetics? You know what I'm saying? Were they getting this injected? Were these patches? You know, breaking it down. So you know how things just go out into the world. We'll make one claim and it just travels like crazy. So then hormones got a really bad rep. And even still, like you say, with male hormones, with male health, when we did Viagra, and we know that Viagra could kill you, give you a heart attack, right? What did they do? They went back to the lab and restudied it. Oh, right? They went back and say, well, how do we prevent that? Who shouldn't be taking it? So then they came back and say, wait a minute. If the guy has heart issues, right? If he has high blood pressure, that group of people shouldn't take Viagra. But did they take it away from everybody? No.
Right? Did we find out about the cancer piece? Because I remember when my mom was going through menopause, first of all, it was a shit show. And second, she would not take hormones because she said hormones cause cancer.
Exactly. That's exactly what we were told. It's like, and nobody really studied, like, where did that information come from? First of all, it's really old information off of a very small group of people. So anytime you had data, you have to ask how many people were actually in that study. You know, were you looking at a subset of people? Were you looking at millions of people? And then also, how long did that study go? Was it a short study, right? Or was this study over decades of time, right? So we can get enough data. Also, understanding who was at the base of that study, okay? So it's just like if I ran a dairy farm, I'm going to be like, listen, milk is going to save your life. Because I have something to benefit. So we have seen that sometimes studies can be supported, financed, you know, and even backed, right, by people who have a vested interest in that study as well. So then we go, how old is that data? Is that still current? So sometimes you could go back and say the doses they were getting were too high, number one. Number two, were they just getting pure estrogen? Right? Were these people still cycling when they were getting these hormones, or were they truly in menopause? All of that stuff affects the outcome. Then, of course, are they already predisposed to cancers? What are their family history? You know, more information. Now we have more information. And then, of course, we also have now more bioidenticals going on, where these hormones do not have the synthetics in them. And they more match closely to our own biological hormone factors instead of some, you know, manufactured in a factory somewhere. It doesn't match you. Okay, so those are some of the things to consider when we talked about these old studies, which just wiped hormones off the table and didn't come back and say, okay, let's come back and see what we were actually dealing with. You know, let's come back and see how we can fine tune this and make this better and healthier and safer instead of just saying no, never.
So, sorry, I have a lot of questions.
Sure.
Once you are postmenopausal, like let's say the doctors said, "Oh yeah, you've already completed menopause," can you still do hormone replacement therapy, or
that's when you want to do it? Yes, you're out of the game. Oh, you're not out of the game at all. Yes. So when you're post-menopausal, now the great thing about being on the other side of menopause, sometimes some of your symptoms will just taper off. So some people, they will have the worst of it, and then when they're on the other side, their symptoms taper down. However, a woman who is in menopause, putting her hormones back on board will help with some of the symptoms like hot flashes.
Yeah.
Right. Progesterone helps the ability to sleep, to fall asleep and stay asleep. So as a woman's progesterone levels drop, and progesterone means progestation. Okay. So men make testosterone, men make estrogen as well, but they don't make progesterone. Okay. So it means you have to have a uterus. And as you lose progesterone, which has a calming effect, now you're up at 3:30 in the morning for no reason. Or you keep catnapping, you drop off, and then 2 hours, and then you're right back awake, you know. So a person postmenopausally needs to sleep very well. When we lose our estrogen, we have body aches, we hurt, causes aching. So this helps with the physical mobility of the person. It helps them stop the aching. Loss of estrogen causes vaginal dryness. Okay. If we have vaginal dryness, forget talking about sex, just risk of having vaginal itch, right?
Oh,
yes.
Fantastic.
Just vaginal itch because it's dry. The vagina should always be moist all the time, right? We always have some type of moisture wash and rinse cycle happening all the time. And that is what protects us. The vagina is very acidic because you have a hole in the middle of your body. Right. So this acid is keeping bacteria from inhabiting your body. So as they lose that, then they start having risks of UTIs and BV and, you know, yeast infections and things like that. So we need to keep that vaginal moisture up. Absolutely. Loss of testosterone, your hair starts falling out just like a man. Right. Your bones start getting weak when we lose our hormones. So then we're more at risk of osteoporosis. Then you can't remember a darn thing. You're like, you know, and you're just like you know, and people are like, a pen? Yeah. And it was never going to come. You could have stood there for the next 20 minutes and the word pen was never going to cross your mind. We start seeing that with the loss of estrogen, where we start having that memory loss going on. So yes, people postmenopausally need their hormones for sure. So it helps prevent other disease processes. All right. It keeps you from just kind of shriveling up, you know, and losing out your vibe for life.
I have a client who just went to the doctor, got her labs drawn. And as I'm finding, apparently that doesn't really mean anything when your doctor looks at your labs, but they told her, oh, you're already through menopause, so there's nothing you need to do. But mental health wise, she's having panic attacks every week. And she's like, I've never been this kind of person and I don't want to give up. I'm like close to retirement, but I am like really having a hard time with these panic attacks that are just coming out of nowhere. Have you seen a lot of that kind of?
In fact, so shout out to all of our fellow providers out here who are sending their patients for hormone replacement. So we have a lot of people who are sent by their psychiatrists, their therapists, and all of their behavioral health team who's saying, you know what, we keep increasing your doses and it's not helping. We keep adding on more medications and it's not helping. Right. And they say, maybe you should go get your hormones tested and see if that is playing into how you feel. We also have people who are like, they're a chiropractor, right? Because they ache and they hurt and they're like, you should get your hormones checked and see, you know, is that affecting how you feel? So absolutely. I take a personal offense to tell a person that just because they're through menopause, there's nothing your hormones is going to do. That's not true. You still have the receptors for them. Like, what does that mean? Like so if you don't put anything in those receptors, something is going to find those receptors. They still have the receptors for them. And my patients, their bodies still respond to hormones. So do you need hormones because you're trying to have a baby? No. Do you need hormones at that time, you know, postmenopausally because you're having like irregular periods? No. But that still doesn't mean that these women don't deserve to feel good and to preserve their health, mental health and emotional health for sure.
How does stress influence the hormonal journey, post menopause, pre, the whole hormonal lifestyle.
Absolutely. The entire body and the entire hormonal system is affected by stress. So the body is a very intelligent system. All right. And so one of your biggest hormone producers is your thyroid. Your thyroid sits in the middle of your neck, and it is the master gland of the body. It makes decisions about everything, including growing your eyebrows. Okay. It is the master gland. And then your ovaries. All of these things are in a biofeedback system. It's certain times of day, it's certain days of the month, and right, and it has to have these highs and lows, and they go up and they go down. And the brain is actually sending signals to say, are we good? No, make more. So you can't be under all of this stress and pressure for your body to constantly be having these communication processes. So think about insulin production. Then you eat, and the body perceives how much insulin you need, and then it creates insulin, and then it brings down your sugars, and then you can't do that if you're not sleeping and you're stressed out. It cannot have all of these multiple communication processes all day. So then everything starts to go haywire. So your periods start getting irregular because the poor ovaries are like, it was so much stress. I missed my signal. Didn't even send the signal. So we have signals that come from the brain, which is called stimulating hormones. So we have like follicle stimulating hormone that's coming from your brain. Right? We have thyroid stimulating hormone, TSH, that's coming from your brain. Okay. So your brain is sending communication to the different parts of your body all day. Well, if your brain is under stress, it can't communicate properly to the rest of your body. And your brain and your body is going to choose the most important things first. So sure, your heart will be beating, right? Sure. You'll be breathing, right? These are things that are constantly on systems, sure. But like, will you have any energy? That's fancy. Energy. You're asking for fancy things now.
That's next level.
Yeah, that's high level stuff. A regulated period. Oh, honey, we're just keeping you going. You know what I'm saying? Like mental clarity, good luck. Sex drive, yeah. Fancy stuff, right? So even the way we make and recreate blood cells, right? The way we break down and rebuild bones, all of this is a constant communication system that's happening all the time. So the way that we regenerate is that you have to be at rest. Otherwise, the body feels like, which is your adrenal glands. Your adrenal glands sit on top of your kidneys, right? And it receives your stress signals. So I should also say to women that stress, right, doesn't necessarily have to be bad. So just because you love your children and you love being a mom doesn't mean it's not stressful. So all stress doesn't make you sad. You could be walking in purpose. You could have opened up like a homeless shelter, and it gives you so much, pride, and this is what God asked you to do, and you wake up every day, and you're ready to do this. It's still stressful. So sometimes we see the people who are like school teachers or first ladies of a church or therapists, right, who love their job. They don't perceive the stress that they're under as negative. So they don't think they're stressed, right? So they don't think they're stressed. And then, so you're pulling their cortisol levels like, ma'am, you're running hot. You're running hot. Absolutely. And so sometimes our perception of what is stressful can be very, very, very different. So some people don't have the proper perception of stress. So there's an old saying that says, if you do what you love, you will never work a day in your life. And I am here to say that is false, false, false. If you do what you love, you're going to work more, right?
Uh-oh.
Yeah. Because you like it, right? Because you feel fulfilled. It's joyful. So you're going to actually do more. So that balance sometimes is not internal, so to speak. So when your brain perceives stress, it sends a message to your cortisol levels, to your adrenal glands to make adrenaline, fight or flight, get through it, can't shut down, make the deadline, think, right? And the brain continues to send that stress signal. And the adrenal glands aren't like, hey, she's just worried about that. That's not happening right now. The adrenal glands is like, okay, stress signal. That's all. And it just makes more cortisol. So the adrenal glands don't know that you're worried about retirement and that's not happening for 15 more years. Yeah.
Right.
They have no idea that you're worried about your children and what college they're going to go to, and they're still in the 8th grade. Right? It just sends the stress signal.
So I'm hearing it's like a mutual collaborative communication pathway, right? Like
Yeah.
if you practice managing your mind, addressing your stress,
Yes.
soothing, practicing resting, it helps regulate your hormones and thus makes it easier and healthier in your mental space. And if you're not managing your mind as much and allowing certain distractions to maybe be shiny and distract you and cause more stress, our hormones will respond and kind of give us alerts that we're out of sync, be that through a lack of energy, vaginal dryness,
Mhm.
irritability. Am I understanding correctly?
Sure. Or they can give you the opposite:
Mm.
headaches, migraines, palpitations, flutters, can't sleep, racing mind, right? So it could wire you up as well. And you're
So be
just kind of
specific.
going and going, you say things like, oh, I'm just high functioning, this kind
Oh.
of stuff, feeling a sense of overwhelm often. So sometimes people who feel overwhelmed, it makes them shut down. And for some people who feel overwhelmed, it makes them rev up because they want to get ahead of it, right? It
Mm.
makes you work harder. It makes you show up to work earlier. It makes you stay up later because you're so wound up. So this is why therapy is dope, right? Because you need
Nice.
an external person to say, do you have shiny new thing syndrome? Meaning I'm on another committee, right? I'm part of another group. I've started
Mhm.
another business, right? You're always kind of on to the next.
I feel
And
like
Yeah.
you
she's talking about you, Laura.
I feel like she's targeting me. I really kind of do, but I'm listening.
absolutely. And all of these things increases the stress level, increases the cortisol level. So for a time, the body will match you and it'll keep raising your cortisol so that you can keep going and going and going until it poops out. Until your
Mhm.
adrenal glands get fatigued and they're tired. And you're like, geez, I can't get enough coffee. I went from tall to grande to venti and it's not working. I've added 2 shots of espresso and it's not working. So you can work out all you want, take all the green drink, you want, and all these things for more energy. I have patients who are on 1,000 supplements and they're on gummy this and they're taking all this stuff they saw on Instagram and TikTok and they're like, but I'm still so tired. Until we get you balanced, until
Right.
we get your hormones balanced, you're going to always feel that exhausted and that tired. So once we get you balanced, some of those extra things that you are on, some of your prescription and supplemental medications can start to wane off because you don't need it anymore. You feel much better. This is not to say that you don't need your antidepressant or your anti-anxiety meds. There are some people who are successfully able to completely stop taking it. And there are some people who are able to reduce how much they need, right? Or my third population is the meds that they're on is actually working better because we're removing the hormonal impact, right? We're removing and getting them more balanced. So absolutely. So to answer your question again, so for people who are postmenopausal, they still need balance. Absolutely. They may need lower doses. They may not need as much as somebody who's in perimenopause because they don't have hot flashes anymore, but they need it for their general health. Our people who are under stress will constantly keep undoing the body's rhythm and system, our circadian rhythm. So they need to be balanced as well. And then also, I think the last point I'd like to make is that you don't have to be perimenopausal to be hormonally imbalanced. There are some people who have been hormonally imbalanced their entire lives.
I was gonna ask about that. Like, what age should you start checking? I mean,
When you don't feel well, for
hmm.
sure. So we have some people who are 14 and they're bleeding like a faucet. And
Mm.
they'll just be like, they put me on birth control pills, and before you know it, they're 38 years old and they've been on birth control for 24 years. You know what I'm saying? They've been on it for so long. So knowing that these birth control pills have effects to them, especially because they have estrogens in them. And my theory is always we use as little hormone as possible to get you back balanced. So sometimes you never needed estrogen in the first place. So why give it to you?
Mm.
Let's give you what you need to correct your symptom and send you on your way instead of just throwing a patch or a pellet or something on you. We can't adjust it. We can't lower the dose, and we can't just follow what your body needs. So their hormonal imbalance is not an age group. There are some women whose ovaries have always been off, or they have other issues like PCOS, endometriosis, right? Some people, they have PMDD, which is a huge mental health impact. And that mental health impact is completely fueled by their shift in hormone. When their progesterone drops every month, which it is designed to do, your progesterone has to drop in order for your period to start. Okay? Your progesterone goes back up, and that's what makes your period stop. Okay. So some people, every month when your progesterone drops, everybody starts feeling cranky and crampy and tired. And for some people, it swings them so far, they feel like they're being inhabited by another person. They don't feel like themselves at all. And this could be dangerous because for some women, it's as bad as feeling suicidal.
Oh.
So this is the impact. Yes. So some people know about PMDD and some people do not. But it is now a true diagnosis, and it is being acknowledged as a true mental health shift directly related to your hormones. All right. It's almost unbearable for these women. Absolutely. So we get those too.
So when you do treatment, and this will be my last question, is it shots? Is it pills? I've heard of like a pellet in your butt. How does this work?
Well, for the Happy Hormone Cottage, in the bioidentical way, we do not do pellets. So, and this is our reasoning why. Pellets, first of all, they hurt. So I have a lot of post-pellet people where after 3, 4, 5 rounds, they're tired of getting it done because it hurts. Second, sometimes the body will start to perceive the little pellet, which is like the size of a grain of rice. The body will perceive it as a foreign body and start to reject it. So they'll end up having injection site reactions going on. Okay. The other thing with the pellet is once we put that into your body, it dwells for 90 days, 3 months. So if it starts giving you effect, if it starts making you feel terrible, we can't take it out. And we're like, well, you just got to let it wear off.
Oh, okay.
Right. We just got to let it wear off. So you can't control it specifically to that person. All right. And here we want to make sure we are specific to this particular person's needs. All right. So that's why we don't use the pellets. In our practice, we typically do oral or cream. Okay. So with the cream form, it is transvaginal. So we either put it into the vaginal opening or into the labia where the skin is very thin and it can absorb. So the cool thing is when the woman, we give them a dose, we're able to give them a range. Use this much, but if your hot flashes don't go away, go up a little bit more. Use a little more.
Oh, that's cool.
Yeah, but if your boobs hurt, go down one, right? And this woman, they're able at their own home to go up and go down until they feel just right. All right. And it's specific to them. They're never getting more than what they actually need to turn their symptoms off and to make them feel more balanced. So that is how we don't like to do the injectables because again, when you do cream or oral, we're able to make it very specific to this woman and we're able to change it according to how she feels.
Okay, in real slide. I have one more question.
Go ahead.
Do you guys have a specific pharmacy that you work with? Because I was talking to some other lady in the field and she was telling me that pharmacies have the right to basically add filler or not. And so where you get your stuff filled also matters.
I couldn't agree more. So yes, you will be looking for what we call a compounding pharmacy. Okay. All right. So a compounding pharmacy would not do that. So the one that we have is called Integrative Hormone Center and Pharmacy, which is in Dayton, Ohio. So thankfully, I'm not having to go through a third party. This one is in direct collaboration with the Happy Hormone Cottage. But for women who are out there who may not be in those states, they are specifically looking for a compounding pharmacy in which they make the hormones on site so that they don't have to put a lot of fillers and preservatives and color and, all these type of things in them, which tends to have very bad effects, especially if the person has like autoimmune issues. Or gut issues, things like that, inflammation issues, migraine issues. You don't want to be using any other filler in the body. And so ours is, again, IHC, which is Integrative Hormone Center and Pharmacy in Dayton. So yes, that's our distribution center.
Okay. So you guys are in Ohio and Florida. Is there anywhere else?
No, that is where we are at this time. So we do ship to other states, but physically located. I am in the state of Florida. I do complete telemedicine, and that is to the benefit of Florida because that means I can see patients that is as far north as Tallahassee and Jacksonville, and I can see patients all the way down in Florida Keys. You know what I'm saying? So for the whole entire state. Whereas if I was in a set clinic, I would only be able to see patients in one small location. So we do telemedicine and on site as well.
Okay, awesome. Well, my gosh, that was so much information, and I'm so appreciative of your time. And Laura did have to jump off. She had another thing come up, so she had to go there. But I know that she really appreciates this too, because I was watching her face the whole time. I could read her mind a little bit.
Yes.
But this is wonderful because, you know, I feel like women get forgotten a lot. Women, and especially they say that we become invisible at some point, and there's all kinds of ageism and whatnot with women as we get older. And it's good to know that there are people in our corner who are trying to help us out and help us feel good. And really, that's my goal, is to just help people to be able to feel better and get down to the root causes, because like you were saying, getting a pill is no problem. We can get a pill easily, but is that going to make us feel better? Is that going to address the root cause? And I feel like this is becoming, the information is becoming more available to people. And so there's a lot more questions now. So I really appreciate you taking the time to help us understand how this stuff works.
Absolutely. It's my pleasure. I would say with the Happy Hormone Cottage, it started with women. A woman was 36 years old and had a hysterectomy, you know, and they asked her ovaries in, ovaries out. And then she's like, well, I guess you should take it all, and woke up in menopause. You know, wow. And so at the time had to do a lot of self-research to say, there's no help out here. You know, what is going on? Then I also see that some women, when they come to me, they have been prescribed something just based off of symptoms, but that may not even be their problem. So I've had some women who have hot flashes. They've been given estrogen, but they're actually estrogen dominant. So they're giving their so I'm like, the reason you're hot is because you make too much estrogen. So getting tested is really, really important, and not just taking things off the internet or just, you know, taking something that they found somewhere.
Making the best guess.
Taking the best guess, see if this works, you know. Yeah. So getting tested is so essential so that you don't do more harm than good. Because again, you end up giving, you know, hormones a bad name.
Yes.
And then knowing that now we are more vocal, each one reach one. So, you know, once you get help and you see a woman across the room fanning, you know, you see a woman in the hair salon, please pass that information along to know that we are making our voices louder. We are saying this is normal, and something that is so normal and natural should be normalized. It should be loud. And also our men should know more about it as well. Men need to understand how our bodies work because we coexist together. You know, so this should not be something that you're whispering in a closet, trying for your husband or whatever not to hear, or your dad. This is something that we should all know, so that when our daughters get older and when their sons get older, they'll be able to say like, oh yeah, I remember when my mom had this. And they'll, instead of being like, I've never heard of such things.
You know what my dad told me? So like I said, it was a shit show with my mom. And I asked my dad, like, ooh, how do you tolerate her? She's so intolerable right now. And he said, oh, well, I remember when my mom went through menopause, she cried for 2 years. And I was like, what?
Bless his heart. That's it.
Look forward to.
That's it right here. And then the next generation of men will be men who say, hey, hon, I've noticed that you're kind of changing and you're crying or you're more upset. Maybe you should get your hormones changed. I remember when my mom got her hormones balanced. She was much better. You see that?
Yes, I love it.
Absolutely. So we want them to be comfortable with that. And also knowing that we also treat men as well. So the Happy Hormone Cottage does have men's program, but we, they do treat men as well because they have hormone changes as well. So we need to make this more of a human experience, a people experience. This is just how it goes. And, you know, we want to get everybody back balanced so that, again, as I said earlier, this does impact your relationship with your significant other. It impacts your relationship with your children, your friends. If you feel terrible and don't want to be bothered with anybody, You're
Yeah.
not going out having a good time, right? This
Yeah.
affects your relationship with your work that you do and your job and your coworkers and colleagues. So this is bigger than just getting on hormones so you could, feel 20 years younger. I want you to feel 20 years younger. I want you to feel your age and feel great at that age. And then again, the next generation won't be so afraid to age. The next generation won't be weeping because I think I'm perimenopausal. And I also want everybody to understand that perimenopause can start as young as 38 years old, right?
Yes.
And I do have people who are 42, 43 who are completely menopausal. They're done. So
Wow.
menopause is it could be a 10-year journey. And then also for some people, it's pretty instant. They had a period in February and it never came back. You know?
Wow.
Yes. So that's another thing. Everybody's menopausal journey is different.
Yeah.
No two women have the same symptoms, just like a period, right? And no two women feel the so just because you didn't feel like your friend doesn't mean your feelings aren't valid. You know?
Oh, I love
Yeah,
that.
absolutely. So we're just keeping in mind that never tell somebody like, oh, you're too young for that,
Oh,
right? She could very well be having hot flashes at 37 and a half. Like, I think, she could very well be emotionally imbalanced. So it is really good that we feel this way. And we're starting to get into those 40s to, go ahead and get yourself tested instead of suffering through it. Because
yeah.
I can't tell you how many women I get who says, I wish I would have did this earlier. I wish I would have did this earlier.
I
Yeah.
bet I could see that for sure.
Yeah.
All right. Well, we will definitely be sending people your way, and I'm so excited to be able to collaborate with you. And again, thank you for your time and this information, and we'll look forward to connecting again soon.
And thank you so much. And I'll be sending people to you because we need to work hand in hand, right? Get your hormones balanced and get your mental health addressed, get your stress levels addressed, and you need a therapist friend for sure.
I love that. All
Thank you so
right,
much.
girl. Thank you so much.
All right. Take care. Thank you.
Bye.